This explainer is based on the patient information sheet Cerebellar Ataxia, a plain English information sheet for patients and families, published by Australian Dizziness Clinics, available at australiandizzinessclinics.com.
Hello, and welcome to this explainer. If you, or maybe a loved one, have just heard the words cerebellar ataxia from your doctor, well, it's completely normal to feel a bit worried or overwhelmed. Hearing a new diagnosis can definitely be scary, especially when it involves your brain and your balance. But please know you're absolutely in the right place right now. Today, we're going to walk through exactly what this condition is together, and we'll do it using plain, simple English. Our goal here is to give you a really clear structure for understanding what's going on, what to expect at your next appointment, and most importantly, to offer you a real pathway of hope and some practical steps forward.
So, here is our roadmap for today. We'll be covering 1. Your brain's autopilot, 2. Symptoms, 3. Clues to the cause, 4. The testing process, 5. Treatments, and finally, 6. Your long-term outlook. Okay, let's dive right into Section 1, your brain's movement autopilot. To really understand ataxia, the very first thing we need to talk about is a specific part of your brain called the cerebellum. You can think of it as your body's ultimate movement control center. And let's clear something up right out of the gate, because this is a super common point of confusion. Cerebellar ataxia is fundamentally a balance and coordination problem. It is not a muscle weakness problem. If you've been feeling unusually clumsy, or maybe like your legs just aren't doing what you're telling them to do, it's not because your muscles are failing or losing their strength. Your muscles are actually perfectly fine. It's the coordination signals that are getting all mixed up. And looking at the anatomy brilliantly illustrates why that happens. Notice that area tucked right at the back of the head, just beneath the main part of the brain. Well, that is the cerebellum. It acts exactly like an autopilot system on an airplane. When you reach for a cup of tea or simply take a step forward, your cerebellum is constantly comparing what you intend to do with what your body's actually doing, and it instantly smooths out your movements. When that autopilot system gets disrupted, well, the movement becomes uncoordinated, and that is exactly what we call ataxia. Moving on to Section 2, symptoms you might notice. Now that we know what the cerebellum does, how does a disruption in this autopilot system actually feel in your day-to-day life? Well, because the cerebellum coordinates so many different types of movement, ataxia can show up in a few different ways. You might notice unsteady walking, almost feeling a bit lurching, or even drunken, even when you haven't had a single drop to drink. Your hands might feel unusually clumsy when you're trying to button up a shirt or write a quick note. You might experience slurred speech, or perhaps some dizziness and jumpy vision. If you are experiencing any of these things, please know that your feelings are entirely valid. This is exactly how the condition presents itself.
All right, Section 3, clues to the cause.
Now, what's absolutely crucial to understand here is that cerebellar ataxia is not just one single disease. It's actually a syndrome, which is just a medical word for a group of symptoms, and it has a lot of potential causes. Your clinical team's job is to play detective and find that specific cause. And what's really interesting is how your own personal timeline gives doctors their very first major clue. You see, the speed at which your symptoms appeared is incredibly important. Did the clumsiness come on suddenly, over just a few hours or days? That points doctors toward things like a sudden infection or a blood flow issue. Did it develop gradually over a few weeks? Well, that could hint at an immune system flare-up or maybe a severe vitamin deficiency. Or has it been slowly, almost unnoticeably creeping in over months or even years? That slower pace usually suggests something inherited or a more gradual wear and tear condition. Your personal story really is the key to unlocking this.
Let's look at Section 4, the testing process explained.
With those clues in mind, knowing what to expect next can really help remove the fear of the unknown from your upcoming medical evaluations. Your diagnostic journey is generally going to follow 3 very predictable steps. First off, as we said, your personal story and a physical examination are absolutely vital. The doctor will watch how you walk, they'll check your eye movements, and they'll test your overall coordination. Second, you'll likely have an MRI brain scan. This gives the doctors a highly detailed picture of your cerebellum to look for any structural changes. And finally, routine and specialized blood tests are done to check for treatable causes, like those vitamin levels or immune issues we mentioned. Every single test is just another piece of the puzzle to help find the root cause.
Which brings us to Section 5, treatments and therapies.
Once those puzzle pieces start coming together, we move into the proactive phase, and this is the main goal of all those tests. Finding the cause early matters most, because in lots of cases, if doctors can identify a reversible cause, such as a severe lack of vitamin E or B12 or an autoimmune condition,
Treating that underlying issue early on gives you the absolute best chance of stopping the symptoms and seeing some real, meaningful improvement. But regardless of the cause, there is always a path forward. Ongoing rehabilitation is the true key to maintaining your movement and your independence. Physiotherapy helps retrain your balance and keep you mobile. Occupational therapy can help adapt your home so you stay totally safe. Speech therapy is wonderful if your voice or your swallowing has been affected. Plus, there are specific medicines that can target symptoms like that jumpy vision, along with proper walking aids to give you full confidence on your feet. You absolutely do not have to navigate this alone. There is a whole team ready and waiting to help you. Finally, Section 6, your long-term outlook. Let's wrap up our explainer today by focusing on the future. The most important takeaway for you and your family is this: rehabilitation, symptom treatments, and practical support all help you stay active and independent. There's always a proactive step you can take to manage your symptoms and improve your quality of life. So ask yourself, what proactive step can you and your family take today to empower your journey forward? Visit AustralianDizzinessClinics.com to download the Cerebellar Ataxia patient information sheet. And please, bring any questions you have to your next appointment. For the patient leaflet and the rest of our patient series, visit AustralianDizzinessClinics.com. Please subscribe to support the channel.